Once the skin's clean, I'm physically feeling for where the angle of the jaw, called the mandibular angle, is to create definition here. I'm trying to create a sort of ledge or shadow that separates the jaw from the neck for that model look. My fingers, once they've found the angle, are going to put pressure on the edge of the jaw so the filler doesn't escape from where I've injected it. The needle then enters slowly through the skin until it stops and can't go any further because it's contacted the bone. Once I'm on the bone here, I'm also underneath the jaw clenching muscle called the masseter. It's very comfortable too. We've used no numbing cream in this area at all. And in this case, I'm using 0.6mm per side of Rev&S shape, and I'm well behind or posterior to the facial artery, which is what you don't want to inject into in this area because a blockage in it could cause blindness at worst. The advantage of this filler here is that there's practically no swelling. I can judge my work very easily instead of having to bring the patient back once the swelling has settled to see the true result. As well as that, because its particles are completely spherical, even a really thick filler like this is very, very easy and smooth to inject, which makes my job much easier and is more comfortable for my patients too. I think if you use anything less than say 0.5mm, I find that you just don't see much of a result in these areas. And the main difference between doing this treatment for men and women is that if you put a lot in a woman and make the jaw too wide or square, they can look very masculine. But with men, I can inject that same amount and I don't have that worry because it's quite masculine to have a wide jaw. Now, there's still a limit though to how much you can inject, because what you don't want is the jaw to be the widest point of the face and make the patient look like a pyramid. This treatment is actually very easy to do in a patient like this as well, because he has very little body fat, which means I can find the mandibular angle instantly and know exactly where to put my needle. For patients who are obese or overweight in any way, there's that much fat that not only do I struggle to find the bone at times, but also injecting filler just makes them look more fat in the face instead of defined, because there's so much soft tissue covering the bone up and more filler just adds to that look. So for best results, what I always do for my patients is not just assess their body fat, but also their cheek width. And I base the jaw width on that specifically to make sure that the whole face is harmonized instead of one part of it just looking completely different to another part.